Good evening, everybody, and welcome to what's webinar 19 in the series brought to you by Emerging Minds and the Mental Health Practitioners Network. Tonight's webinar is going to be on overcoming communication challenges to be able to fully engage children. Really pleased to be able to bring you this webinar tonight. But before we do that, I'd just like to acknowledge the traditional custodians of the lands across Australia upon which our webinar presenters and participants are located from all across Australia. We wish to pay respects to the elders past, present and future for the memories, the traditions, the culture and the hopes of Indigenous Australia. So welcome everybody, my name's Dan Moss and really pleased to be able to bring this webinar to you tonight. And we have well over 300 participants joining us so far, so we welcome you, and also we welcome the viewers who are watching this through the podcast at a later date. So yeah, this is series 3 of the webinars that have been brought to you between Emerging Minds and MHPN. And I think this is the 5th in our series this year. We still have one to come in June. And that'll be on shrinking problems with children and families. That'll be coming to you in June. So really look forward to bringing that one to you. In Series 4, which will happen from July this year, we've got some webinars coming for you, including an Aboriginal and Torres Strait Islander children webinar, a webinar on making children visible in work with parents, and one on looking back to the present and forward in work with children and parents. If you'd like to know more about any of these webinars or anything about Emerging Minds, really encourage you to please log on to www.emergingminds.com.au/subscribe to learn a little bit more about our organisation and what we can provide for you in terms of supporting children and families around children's mental health. Just some quick housekeeping around the platform and how to use the platform that we're on. So the purple circle or icon is to open the chat box. We really look forward to your comments as tonight goes on, and as we go through the night. If you use the blue icon for the hand, you can ask any of the panellists a question, and as we go through the Q&A later in tonight, we're going to answer as many of your questions as is possible. So really look forward to that. So please keep the questions coming. The blue downwards arrow allows you to access resources, including the case study tonight, and we also have supplied you the panel biographies and supporting resources. The yellow icon will allow you to open our survey, and if you have any issues, the green arrow will allow you to reload the page or webinar room. So learning outcomes for tonight, really important, and at the end of tonight's webinar, we'd really like you to be able to do a number of things, including describe the key strengths and vulnerabilities which influence the mental health of children with complex communication needs. To discuss how communication difficulties in children can be interpreted by professionals, parents and families. We'd like you to identify ways of engaging and supporting children with complex communication needs, to outline examples of practice which has allowed a strong focus on the mental health and social and emotional needs of children who experience complex communication needs, and to outline examples of practice that has helped parents to support their children to communicate their social and emotional wellbeing needs. So without any further ado, I'd really like to be able to introduce tonight's panel. We've got a fantastic panel tonight with a real wealth of experience with this issue. And first of all, we've got Felicity Pine. Felicity has been doing some great work with Emerging Minds as a child and family partner from New South Wales. Felicity, welcome. And before we start, I'd just like to ask, given your experience helping your child with communication needs, what do you think are the most effective ways that practitioners can provide support for children and parents?
Yeah, thanks, Dan. I think the biggest one is working with the whole family, everybody that's involved, getting on the same page to begin with, and making it very easy for the parent and child to actually understand the process that's going on.
Yeah, thanks so much, Felicity. Really looking forward to hearing your presentation in a little while. Our next presenter is Mandy Flint. Mandy is a social worker based in South Australia. Mandy, welcome. And as a social worker, can you tell me a little bit about your key challenges when you've been working in helping children navigate service systems, particularly where they do have communication support needs?
Thanks, Dan. Yeah, I think as a social worker, obviously I'm looking from a systems perspective, and I think what I usually see is that when we work with children who don't have a formal diagnosis, their access to the system is quite often limited. The other factor, I guess, that comes into play when navigating the different systems is a lot of the systems and services come from a behaviour focus or a behaviour modification focus. And so when we come from that focus, we quite often miss the needs of the child. So I think they're probably the two key challenges that I face in my work day to day.
Great, thank you so much, Mandy. Our final presenter is Melissa Saliba, and Melissa is a speech pathologist, again based in South Australia. Melissa, welcome. And could you tell us about the specific role of the speech pathologist in work with children with communication support needs? You're just on mute there, Melissa.
Hello, thank you. So I think there are some key things. The first is to assess the child's communication capacity. So by communication, their speech, language and their social communication, and doing this in a number of different ways, but I'll go into some of those ways in the actual presentation. Then to analyse and interpret that information, and that may lead to a diagnosis, but it also is used to develop an intervention and treatment plan in response to those assessment findings, and then to work with key people in the child's life to implement that plan in a way that's workable and sustainable. The plan is often developed and monitored and reviewed in collaboration with family and key stakeholders so that it is workable. And then obviously there's the intervention side of things. So to provide intervention, and this might be at a direct level with the young person or the child. It might be at more universal level, like general education. It might be specialised group work. So there are different kind of levels of intervention that might be suitable depending on the needs. And then lastly, our role is to advocate and support the child in getting their needs met. So this might mean supporting parents to navigate different services and having an advocacy role.
Great, thank you so much, Melissa. So we're going to get straight into our presentations tonight, and you'll remember from the case study that tonight we're basing a lot of our presentation around Kevin, who's an 8-year-old child with an intellectual disability. Kevin uses the pictorial exchange system to support his communication, but at the moment his mother, Jessica, is quite worried about some of Kevin's behaviours and how he's going with his communication development. So I'm now going to pass over to our child and family partner, Felicity, to ask for her perspective on work with Kevin. Felicity, welcome.
Thanks, Dan. Yeah, so as Dan was saying about the case study, so some of this tonight is around the case study, and also I'll refer to my 6-year-old son, has been quite non-verbal diagnosis of autism and separation issues. I guess with the first part, I'll start with what I found with my son and with this case study. One of the biggest things is changes in a child's life. The people coming in and out of their lives, going to different services, and having to go to multiple services is quite a struggle. And also part of that stuff is the assessments that the children have to do, and family. The impacts of changes, you know, the child has to learn new ways of working and adjusting. You know, what I found is taking my son to different agencies and services, that everyone had a different way of operating. You know, so it would take my son a little while to understand that kind of stuff and see how things worked. Also, the pressure of taking the child to a service if the child doesn't want to go. You know, there's been times where we've had to, you know, do reward systems. Some days we have to cancel. You know, also the changes of workers that you get. You know, speech therapist. We've had a couple from the same services. Unfortunately, starting to work with a speech therapist, and unfortunately they leave the job, so it's starting at scratch with a new one. Also in the home, you know, first off, it's normally around an hour whenever the child goes into a service, and a lot of that time I found is either watching my child or talking to me for an hour, and then I'd have to remember everything I wanted to say to that service in time. Also, too, I guess the biggest thing, you know, for me is what I found is also people being judgmental, and some people not being judgmental, you know, and I've really struggled with that. You know, some services I've just chose that my son won't go to because of the judgments made, which then he misses out. Like, it could be an awesome service. Also, people seeing different behaviours to what I see, you know, which I understand that we can all see things differently, but I guess there's been assumptions made around my child but never discussed with me. So one, I won't know if it's a new behaviour, old behaviour, or if it's even an ongoing behaviour at home or anywhere else other than whoever's picking it up. Also, to some services we go into, you know, is I wouldn't even like to sit in there, let alone my child. You know, my child's been in a room where it's all white with one little table and just a cupboard. You know, so it's not very inviting, or, you know, or feeling friendly and warm. Also, with that stuff, going to a new environment brings up behaviours for my son or any other child, in fact, you know, of not knowing the place, let alone even wanting to interact with the person. So I guess some of that kind of stuff is, I found, is doing some different therapies at home where he's comfortable. Again, that brings its own dilemma as well. He might be too comfortable and, you know, not want to sit in the same room and interact. But I guess, you know, we can just really consider, I guess, for me, is I had no idea of autism or my child's behaviour in the beginning. It's something that I'm learning, and I'm still quite learning. I'm quite new to this stuff, you know, so acknowledging that the parent's not trained in these fields. You know, I guess at the very start, some parents might not even know their child has any type of behaviours or any diagnosis. I do know with my son, we had one diagnosis and we went to a service, and within a year we had multiple diagnoses that I didn't even know that existed. Telling the parent or the guardian up front what you are doing, what kind of assessments you're doing, what the treatment plan is, making sure that everybody actually understands that stuff. Saying what is actually needed for the child. I know there are many cases that people have told me what my son needed, and I was a bit too embarrassed to say, hey, I don't understand that stuff. You know, so sometimes parents just don't speak up. report with details. You know, I get about 2 lines from one service, and that doesn't give me enough information how my son went in the session. You know, so a bit more detailed other than 1 or 2 lines. Parents can see what a worker is doing right, what's right and what works, and what we see in our child, you know. So I guess in the hour or maybe hour and a half that we've had with services, my son might not have presented what has worked previously, but for my son was quite non-verbal at the beginning of his therapy, and within a year he was speaking. He cannot stop speaking now. He wasn't playing with his like dolls and stuff like that in his toys. Now he does that kind of stuff. Also he reads, you know, he never done that kind of stuff before, you know. So speaking with the parents about the good side of stuff and asking if their children are learning anything new or different. So I guess before I finish up, I just wanted to touch on, in the case study, you know, the parents separating, and my son has just gone through that recently, and my son's moved into a new home with me. And at first I thought that this was going to be really hard and really challenging, and it's been quite easy and amazing. He's asked to go home once, but what I done straight away was I set up his areas. So I set his bedroom up the first day we moved in, the backyard with all his play equipment. You know, I put everything that he knew that was his stuff and his space down straight away before the fridge come in or TVs or anything like that. And I really believe that made it really nice and easy for him to transition into their home. And it's actually gave him quite a better routine. He sleeps a lot earlier now. His behaviours have just really, really changed. But also what's happened is I've been able to, due to COVID and work, I've been able to spend a lot more time with him, which made things a lot more settled for him going into a new space. You know, I guess we just need to remember every child is different and every family is different and our needs are very different, you know. So for me, what I have to do every time I go to a new service is I have to give this spiel about my child and remember every single need I need met for him. But also it's continuously writing application forms out, you know, and I'm not a great speller or and not too well at reading, you know, so sometimes they can be very, very difficult for me, and these agencies want them before we turn up. So I'm really trying to get this stuff done, and it's a lot of work for me. So there's so much time collecting this information, but when we get into this room, there's not that much time spent with us. So we have the 1 hour discussion, and then it seems next week we're right into whatever the agency's doing. We don't have another discussion or anything like that. There's no real space where I can say, you know what, last week I forgot this. It just doesn't seem to come up. We go straight into what we're doing. Also, you know, understanding our children, you know, sometimes that we can understand our children better when they're learning to speak, and sometimes we can't. You know, sometimes I don't understand what he's saying and I rely on the speech therapist a lot, you know, and just really wanting to be treated like his mum and a human and not lower than or less than. And then also explaining my home. You know, I have multiple children and our house is really busy. You know, I guess that's where I find the judgment comes into this stuff, you know. So I guess when families are telling you their life and their personal stuff, you know, to try and keep an open mind and remember these parents are trying to do the best that they can and know how to at that time. Following up with the parents, so, you know, making sure there is that space after the first visit, or having that phone call, asking if there's any more information needed. explore the information. Yeah, and I touched on that very last one, considering where the parents are at with their literacy issues and what they're comfortable with sharing as well. And just remember that, you know, we're meeting strangers as well, so we might not be comfortable to tell all. But I guess for me, overall, wrapping all that up as a parent and as a single mum at the beginning of this stage, it was very tough. I had no idea what to do, no idea where to go, no idea what to say. And it was only from one organisation to the next. So everyone helping out really supports the child and the parent. So that is me. So back to you, Dan.
Thank you so much, Felicity. Really appreciate your insightful and honest account of your own experience and your son's experience there. Yeah, some really valuable lessons, I think, for us all in that. So next, we're going to go to Mandy and for a social worker's perspective on work with Kevin. So over to you, Mandy.
Thanks, Dan, and thanks, Felicity. That was really valuable to hear your story and your experience there. So I guess, you know, in coming back to Kevin and understanding Kevin's perspective, I'll be looking at the whole context of his family and community, as well as, you know, what's going on for Kevin. And key to that are the strengths and vulnerabilities around what's happening for Kevin. So, you know, the strengths include that he is expressing his needs, even if he can't actually get the words out the way he wants to. He's expressing those needs. He uses his picture exchange and through the behaviours that he's expressing. His relationship with his mother, of course we need more information, but there's an assumption there that she's the safe person given she's approached services for support. Another strength is that he wants to be heard. He's frustrated. He wants to be listened to, and we really need to pay attention to that. He's connected to school, which is a really important thing. And Mum is proactive. She's out there trying to get support. She's seen the changes in Kevin's behaviour and she knows that he needs additional support. In terms of the vulnerabilities, well, the communication skills are obviously need to be assessed to know more about that, but his needs aren't being met and his ability to convey those needs is limited at the moment. Family tension and separation is another area. So Kevin's world feels unsafe right now and unpredictable. Things have changed. He's lost relationships. So, you know, there are key vulnerabilities there we need to work with. And we need to know more about the father, his parenting capacity and his relationship with Kevin. Does he have, you know, a relationship there at all? Can that be worked with? So when thinking about how to interpret, I guess, the communication difficulties for Kevin, I quite often look from a perspective of what's underneath behaviour. And so behaviour is a form of communication. Children with communication challenges, young children often have difficulty expressing themselves verbally. And so the expression of their needs comes through their behaviour. Having communication difficulties doesn't mean that the child doesn't have feelings and thoughts and needs. And I think that's really important to think about. And, you know, considering the unsaid information there. So these are all assumptions about Kevin. And of course, we need to find out more. But for me, I'd be curious to know, you know, does Kevin feel safe at home or does he feel unsafe due to the past history of tension in the home? You know, are there triggers for him around particular memories that were unsafe or difficult for him? The grief and loss that he may be experiencing and not seeing Dad anymore and that change in his life and his family. Self-blame about the separation. We know that Dad had difficulty with Kevin and was hard on him. You know, has he interpreted that in a way that says it's his fault that Dad's left? And fear and worry that he may not see his father again. So again, these are assumptions, but you know, are these some of the things we need to be considering in how Kevin is expressing his needs through the aggression and the escalation of behaviours for him? In terms of engaging and supporting Kevin, safety and relationships are the key factors for me. So how do we create safety? So safety through predictability, through being open and transparent, being aware of his sensory needs and his developmental needs, understanding his history, his likes and dislikes, his interests. And I always look for anchor points when I'm working with kids. all kids, but particularly kids with developmental needs or with communication needs? What are the anchor points that I can hook into to engage the child? Do they love soccer? Do they like space? What is it that I can kind of anchor myself into some sort of connection and relationship with them? And I think to not make the assumption that I'm going to form a relationship, with this child in 2 or 3 sessions. It may take a long time. And that can be difficult when we work in services where we have limited ability to spend time with children, but we have to do the best we can. I think in terms of thinking about Kevin coming into a space, so working in a private practice at the moment, I'd be thinking about what does the space look like? What are the sensory needs for Kevin? Is there too much noise? Is the lighting too bright? Are there funny smells in the room? What do I need to understand about his needs before he comes into the space? And then what resources can I provide to him? So picture-based resources, emotional literacy tools, toys, books, talking mats, all of those things to help him to be able to express his needs as much as possible. Considering the neuroception of safety, and so I probably should have talked about this more in the first point there, but understanding the nervous system is really important. So what's going on in Kevin's nervous system? He comes into the space and he looks down at the floor, which is a good indication that he doesn't feel safe. It's a new space. As Felicity was talking about, change can create a sense of lack of safety. It can also make a child withdraw and not want to connect, let alone any other developmental issues that are going on there. So thinking about that in terms of understanding what's happening in the nervous system around the child's ability to socially engage, or whether they move into mobilisation or immobilisation when they're in a different context or with strangers, is really important. And I think most importantly, I would be wanting to engage with mum. It's really important to understand, speak to mum before having a session with Kevin to really understand what's going on. I think Felicity pointed that out, that, parents, they know more about the child than anybody. We need to understand from their perspective what's happening. They're dealing with, the child every day. So working with the parent around that, and having the parent as a safe person in the room, if that parent is identified as a safe person. So that would hopefully help Kevin to feel more at ease. So quite often when I'm working with children who don't want to talk initially, I may talk through mum or dad and try and work with them that way. And sometimes that can be helpful. So thinking about examples in practice. So for me, it's meeting the child where they're at. We quite often have an agenda about what we feel we need to achieve or do on that day. And quite often we throw that out the window when we're in session with them. We have to meet them where they're at. If they're escalated and they need to be regulated and supported to feel safe, then that's what we focus on for the session. We need to meet the child where they're at. Tapping into their interests as anchor points is really important. I'm working with a young girl at the moment who loves vampire diaries, and so the vampire diaries are a great way to work out different emotions, because she can attach different characters to the emotion states. And so we work with that as her way of understanding and building emotional literacy. Collaboration. So, being really transparent and open and respectful and articulate in the way we talk with both the parents, any other services involved, as well as Kevin or any child that we're working with. And giving really explicit and concrete examples. So not talking metaphorically, not being too general or broad in the way we explain information. So quite often picture cards and social stories and those sorts of things are really useful to assist with that. And role modelling is another area. So really role modelling what's happening. So quite often in session with clients, I'll talk a bit about what I notice in my body is happening when I'm going through something. Oh, I'm feeling a little bit wobbly today, or I'm feeling a little bit tight in my chest today. I'm just going to take a deep breath and role model that to the child. I think that's really important, and to the parent as well. Naming the emotions, issues, strengths and vulnerabilities, I think is really powerful if we have the opportunity to do that. And using the pictorial tools and cartoon strips and visual stories. So visual stories are really important, I think. And I'm working with another girl who's struggling to transition back to school. She is having attendance issues. And so what we're working with at the moment is a visual storybook of how we'll get her back to school and what's going to happen as she transitions back into the school environment. And thinking about the parents, the parents are doing their best. They're working really hard to try to support their child. They worry about their child, they care, and they're invested in their children. So the best way we can support them is to resource the parent as much as possible. Felicity talked about that earlier. Psychoeducation around, what's happening with the emotions, the neuroception of safety, window of tolerance. So I quite often do a lot of work with parents and with children that have the capacity to understanding the window of tolerance and what's happening in their nervous system. So are they moving out of their window into mobilisation or a fight-flight state, or are they moving down below their window into an immobilised or flat withdrawn state? And so how do we bring them back into their window, or how do we widen their window so they feel safe and able to socially engage? So they're some of the conversations that I'll have with parents and talk to them about how to support their child. And thinking about behaviour as communication too. So as in the previous slides, getting them to think about what's going on underneath the behaviour. What do we need to be thinking about for this child? What is the child trying to tell us? That's really important. Psychosocial support, so considering the whole family unit, what's happening for the whole family, because whatever's happening for the whole family will impact on Kevin, will impact on any child that we're working with. The parent wellbeing, what does mum need? Does mum need a break? Does mum need extra support? Really exploring that is really important as well. Advocacy and resourcing as much as we possibly can, and we know that's not always easy when we have a under-resourced system, but we do the best we can. And where we need to engage the parent and the child in relationship repair, I think that's really, really important as well. And that is me. Thank you, Dan.
Thank you so much, Mandy. Some really amazing, detailed, practical strategies there, I think, to help practitioners with children and their families. So thank you. Looking forward to asking you some questions about that in a moment. So now to provide a speech pathologist perspective is Melissa. Melissa, over to you.
Thanks, Dan. So I think it's important to start by just defining what communication is and what do we mean by communication. And when we use the term communication, we use it as like an overarching term to encompass different components like speech or the clarity of articulation and speech sounds, like language, which has got two components to it: understanding language that's spoken to you and being able to formulate and know the and also the social aspect of communication, which is communication in use in a social sense, in a social context. So with that in mind, I'd like to start by acknowledging that there's a known researched association between communication disorders and emotional and behavioural disorders. So this knowledge underpins any approach to take with Kevin and the key people in his life. So the pink infographic on the slide is from the Royal College of Speech Language Therapists, and it shows a few possible examples of how having a language disorder could lead to feelings of anxiety or frustration. Multiply this experience across the day, across the week, across the years, and you can understand how over time language disorder can manifest itself in behavioural and emotional issues. In the study by Hollow and colleagues, emotional and behavioural issues existed for 57% of the language disordered children they studied. And other studies have shown that children with language disorder have greater levels of anxiety and are at greater risk of conduct and emotional problems. In Kevin's case, it's obvious that he has communication needs. However, in up to 81% of children and young people with emotional and behavioural disorders, they could potentially have an unidentified or hidden language disorder. For Kevin, we're aware that he has communication needs in association with intellectual disability and has been expressing himself through his behaviours. At this stage, we can only hypothesise why. So let's have a look at what we currently know. Okay. So what we know is that Kevin is a boy who's been diagnosed with an intellectual disability and has experienced recent changes at home. He may have experienced some level of anger from his dad, but we don't know how that was expressed and whether he was exposed to that verbally, physically, or both. We know that his aggressive behaviours are worse after coming home from school. We know that Kevin communicates his thoughts and feelings using PECS, a picture exchange communication system. If you look where the pink arrow is pointing, that's what PECS can look like for those that don't know. And so it uses symbols, pictures as symbols to represent his messages, but he's also communicating through his behaviour. We currently don't know what his language comprehension, verbalisation and gestural skills are like. We don't know what he's thinking and feeling, but we can try to give him the means to express it so that it's in a way that's safe and acceptable socially as well. And we can also arm him and the people in his life with skills to identify behavioural whispers or the little signs and intervene appropriately to support him to express himself in safe ways before they turn into louder behavioural shouts. Okay, so the first step would be looking at assessment. It's a critical first step in understanding Kevin's communication strengths and needs, as well as how they interplay with his behaviours and social or communication interactions with others. Assessment will also inform the development of the intervention plan. An obvious question is around the use of PECS for communication. I'd be interested to know what role PECS plays in Kevin's communication. Is it his primary alternative mode of communication, or is it augmenting or supplementing other forms or verbal forms of communication? I'd also be aiming to determine what phase Kevin is in with PECS, whether it's meeting his needs, to what extent he uses it, and how upskilled and responsive those are who are around him, so family and staff, to be supporting his use of PECS. Given Kevin uses PECS, I would assume that he's at a level of intentional symbolic communication, which means that he's using pictures as symbols to represent what he wants to communicate. But I'd also like to know more about the extent of use, his repertoire of vocabulary, and what other ways Kevin might be communicating, such as conventional or unconventional behaviours and gestures. I'd also like to know more about his ability to sustain joint attention, his play skills, his expressive and receptive language abilities, and his speech clarity if he does have any verbal language. How much does Kevin understand what's said to him? And if he is talking, is it in words, phrases, sentences, and is it clear, or are there coexisting speech sound disorders? So also assessment is not just for Kevin, but to look at how others communicate with him too. What's his environment like? How much do Kevin's family and educators understand about his communication skills and needs? How are they interacting and communicating with him? Are they attuned and noticing his bids for communication? Do they respond appropriately? Do they pitch their language at a level that he would understand? And so on. So I would be doing this assessment work in partnership with his family, key people in his life, educators, other multidisciplinary staff, etc. And it might take the form of informal observation, informal assessments. It might be looking at that observation in different contexts so that it's not just at school but at home or at playground or wherever, I guess, what your service kind of allows you to have scope to do. And you could assess in formal ways as well if Kevin tolerated it, such as using specific formal assessments that are directly done with Kevin. But there are also other ways to gather information collaterally through questionnaires or checklists or data charts and stuff like that. And there's a really good tool that I like called the Communication Matrix, which is actually free. So if you Google that, if you haven't heard of that, that's a great tool. It doesn't just have to be used with speech pathologists. So let's move on. So the other part to assessment is not just about communication, but also the interplay between communication and behaviour. So what is the function behind Kevin's behaviour, and how does his communication skills play into this? Given we know that communication and emotional and behavioural issues are often coexisting, in Kevin's case, why is he getting frustrated and aggressive and reactive? If you think back to that pink infographic in the first slide, is it because he's not being understood? Are his communication attempts going unnoticed? Is he being ignored, maybe unintentionally, or misinterpreted? Maybe people are trying their best to understand him and what his messages are, but it's just really hard to interpret and understand them. Does he lack the intentional communication skills that are required to adequately express his thoughts, feelings, needs and wants? Is he getting his needs met? Using a functional behavioural assessment model and in partnership with key people in Kevin's life, such as family educators and other staff, I would aim to gather information about Kevin's challenging behaviours in the context of communication through methods such as observation in different contexts and environments, very similar to the communication assessment, through consultation, questionnaires, charts and data collection. We want to understand the context of the behaviours and look for patterns to the behaviours, such as when do they occur, who do they occur with, where is he when they occur. We also want to look closely at whether there are any low-level signs or those whispers, the behavioural whispers that indicate he's on the way to escalating into some bigger, more challenging behaviours, because they can give us clues to look at what's going on around him or inside in terms of where it has started from. And so then from that, we can use all that information to develop a hypothesis about the function behind Kevin's behaviour. And from the hypothesis, we can develop a plan of action to address Kevin's underlying needs and hopefully redirect him to more acceptable alternative behaviours, as well as increase the awareness and skills of family and staff so they can mitigate environmental factors that might be contributing to his emotional dysregulation, as well as strengthening his skills and trying to increase the frequency of those acceptable alternative behaviours. Just excuse me for a second. So now if we look at intervention, and inherent to intervention is ongoing review, evaluation, and like tweaking and modifying the different approaches. The intervention is informed by the analysis of all that assessment information. I'm presuming that in Kevin's case, we would be looking at intervention which is targeted, intensive and specialist. We'd be looking at the provision of individual therapy as well as programming and capacity building for home and school, with the key goals of helping to redirect Kevin's undesirable behaviours into safe and effective ways of communicating. This might be through modelling and supported experiences, using pictures or a social story to show him other options, intentionally setting up situations that kind of set him up to experience the different alternative ways and supporting him through that. Another goal would be to expand Kevin's communication skills generally, but also specifically around increasing his knowledge and use of emotional vocabulary, given that this is like an acute time where his emotional needs seem to be a bit heightened. So that might be just a really practical target in terms of vocabulary for him and powerful and empowering for him. So that could be verbal, gestural, or using text. Another goal could be to increase the responsive interactions between Kevin and his family and school staff so that they notice when Kevin's trying to communicate by whatever means that is, and they respond in a way that supports his emotional regulation and expression in safe and effective ways. And finally, another goal could be around looking at the environment, because we exist in an environment, so adjusting the environment to minimise Kevin's frustration and increase opportunity for him to communicate in those effective and safe ways. So whether there are factors in the environment that raise his levels of emotional dysregulation, and I guess working in that multidisciplinary team and understanding that from also an OT's perspective would be useful. So some take-home messages from me would be, and I think this message has come through the whole presentation, that behaviour is a form of communication and there's always a reason behind the behaviour. We want to identify what Kevin's communication skills and communication and emotional needs are and work towards helping him to express his emotions through ways that are safe and effective. This can be done by increasing his communicative skills and the skills of those around him to notice and respond appropriately to his attempts to communicate. And another key message is that through thorough assessment and specialised intervention, we can aim to reduce the circumstances that lead to frustration and increase the ability to express emotions in those safe and effective ways. The targeted and specialised intervention can include the direct work with Kevin as well as through the important people in Kevin's life to increase attuned and responsive interactions, to modify the environment and to enhance communication opportunity and reduce his frustration and to increase his skill development. Realistically, the frustration and aggression might still happen, but we can try to work towards more desirable alternatives of expressing his emotions through skill development and those environmental adjustments. That's all from me, Dan. Thank you.
Thank you so much, Melissa, for that incredibly detailed and skillful presentation. Really appreciate that. So now it's time for question and answers. And yeah, thanks to the over 450 of you who are tuned in to tonight's webinar and to all the great questions. So keep those coming, please. We'll try to get as many questions from you guys answered as possible. But I might start with you, Felicity, if that's okay. And some questions here really asking you to kind of elaborate a little bit on some of the content you were talking about as a parent. So do you have any tips for other parents whose child might be non-verbal and might also grow frustrated with those around them that can't or don't understand their needs?
Yeah, thanks, Dan. I guess the biggest tip for a parent is just to hang in there, that this stuff will pass, you know, once you get things into place and start understanding. I don't believe that some of my son's earlier moments, you know, was going to last forever, but I've had to remind myself that this will pass. I guess, you know, informing a parent that this stuff can be a roller coaster, you know, getting everybody involved, the places that you need to be, when you need to be, you know, but you're your child's biggest advocate. And you know when enough is enough and you can't do any more for the day or for the week, or what's going to work well or what's not going to work well in terms of appointments. You know, I guess, you know, I didn't touch on that in my presentation. You know, that's been a very, very hard thing for my son to start school this year, go from 9 to 3 at school, then 3:30 to 6 o'clock at therapy, and then to drive home an hour later, and then to have the rest of my family ready for dinner, bath, bed. You know, to do that 5 days a week is just not possible, you know. So I guess for the parent or the caregiver, you know, to speak up when things are not okay and it doesn't suit. Yeah, I think that's about it.
Yeah, thanks, Felicity. And while I have you, a question from Amelia. In your presentation, you mentioned judgment before in services, and just kind of interested to know, how do you at an early stage kind of, what do you know, how do you know that a service or a practitioner might be judgmental of you or your child from an early stage? What are kind of the signs that you're looking at that a practitioner is going to be non-judgmental and curious and open?
Yeah, that's a good one. I guess, you know, for me to be judgmental now is the person's body language, their tone, I guess example is one day we went into speech therapy and me and my son didn't have shoes on. We just went straight from home to the car, into this speech therapist around the corner. And as soon as we was met with the lady, she looked down at our feet and then looked back up at us, and just her facial expression said it all. And I just said, this is how we're comfortable. So I guess, having them same type of expressions every visit, keeping that stuff natural. I guess that really open-mindedness that we all dress differently, we all speak differently, we all behave differently. There's no one type of great parent or great child, that kind of stuff, but definitely the body language, making sure that you're being kind and welcoming, being really warm and friendly, really open, and I guess that's the same for us parents. That's how we feel we've got to be as well. Well, I know for me, I feel everything that I say now is how I feel that I've got to act as well to other people going into these services as well, making sure there's a lot of respect.
Yeah, thank you, Felicity. Great answer. Mandy, I might go to you now because there's a couple of questions here for you. And one of them from Josh and others. As a social worker, how do you help children express what they are trying to communicate through their behaviour? What are some of the strategies and skills that have been most effective for you?
I guess they're many and varied. So I quite often use play and art-based therapies with children. So quite often a lot will come out through the play process, and I quite often will name what's happening in the space. So name my observations of the play, but also name what's coming up for me in my nervous system. So I'm heavily focused on a nervous system response, and understanding that if I'm feeling a little bit sleepy or a little bit flat, then maybe the child is. If I'm feeling really nervous or agitated, maybe the child is. So naming those things and actually really putting it out there for the child, and then engaging in some strategies to, I guess, manage that. So breathing and movement and stretching and those sorts of things, and bringing that body awareness. And I guess what I find, or what I have found, is by doing some of those simple things, the child actually starts to relax, because they go, oh, this person is actually really tuning in, rather than making any assumptions. Because I may be wrong sometimes as well. But I think that's really important. The other things I do, I guess I use social stories. And so thinking about, how does this child understand what's going to happen in the therapeutic process? What are the steps that they need to understand coming in, but also while we're there in the space? And so that's really an important part too, having really clear pictures that they can follow to understand, because we know that that change and that uncertainty, moving from one space to another, the transitioning space, can be quite threatening and cause dysregulation for children. The other thing I do is I work from a ritual perspective. So quite often a number of the children that I work with have trauma, which quite often mirrors and is very similar to some of the diagnoses that we see. And so I will have a process with them that we establish a routine. So our routine might be that they come into the session, we go and walk to the kitchen and get a snack. We come back and we sit down on the floor and we eat the snack together, and then we start the session. And at the end of the session, we go and wash our plates. And so we go through this process, and we do this every time. And so what that does is it builds that predictability and that consistency for the child. I guess I also use a lot of body-based processes. And so one of the young people that I'm working with at the moment really struggles to connect with her body. So understanding where emotions might be in her body, what it feels like. She doesn't like talking about her emotions. And so I'll engage in activities with her like 5 things you can see, 4 things you can hear, 3 things you can smell, and so forth. And we do that at the end of every session that we have together. And she's got into a real routine with that, and it's kind of something that she really enjoys doing and looks forward to doing at the end of the session. So I guess I try to be as flexible and open, and sometimes it's trial and error. You try something and it doesn't quite work out the way you thought, but other times it's a hit and they want to do it over and over again.
Great. Thank you so much, Mandy. Melissa, I might go to you. I have a question here about, can you discuss how you support parents to negotiate a challenging service system and to get the best possible support for their child? How do you do this in ways that still involve parents and children in the decision-making process? Just unmute there, Melissa.
I'm that person. Okay, so I guess the first step is knowing what the services are that are around you in the community, both public and private, so that you can be well informed on what to discuss with the family. But besides that, I think working in partnership with a family means listening first to them about what their barriers to accessing services have been or what has worked well for them, so that they can be supported to make informed decisions. So, and then on the flip side, so that there's the active listening from their perspective about how it's going well and not struggles as well, but also making sure that we're informing the parent and helping the parent really understand from our professional perspective of what we see as the child's needs being, so that they can make those informed decisions based on knowledge. So with both of those things in mind, I then would present the options of what they could access. Oftentimes there's not that many options, especially free government services. And so in presenting those options, it might not just be by speaking about it, but it might be mapping it out visually, like taking into account that it's a lot of information to take in. So, you know, and also taking into account the parent's literacy or English level, so that by using some sketchnoting and some visuals, they can take that with them as well and retain that information. So basically laying out all the options, pros and cons to both, what's involved in those options. And then finally, if there's a need for advocacy, then I'd support that process as well with the parent's permission, such as communicating with service providers or providing supporting documentation, helping the parents, like encouraging parents to know that they can be advocates themselves and encouraging them to take those steps as well, but also understanding that it can be scary and daunting to do that. And even as skilled advocates, we come across lots of barriers as well. So I think they're kind of the main things.
Great. And I've got a question coming through, Melissa, just about the use of tech. So you mentioned in your presentation about the importance of ensuring that key practitioners and people in Kevin's lives were able to use that tool consistently with him, and that some of your job entailed kind of observing that. Are there particular things or strategies that you can do to ensure that the people in his life use that tool consistently with him?
That's a really good question. And I've got to say, I did PEC training a really long time ago, like years, and it hasn't been my area of, it's not a specialist area for me, but I guess I would be looking over all of that information and knowing assessing at what level he's using the PECs, and just communicating with families around making sure it's really transparent, that they know what all those steps are and what they mean, and modelling it or actually getting them involved to do that in the session, so that they, drawing upon one of the things Felicity mentioned way back was, it's very easy as a therapist to think you know and you can show what to do, but it's actually really important for parents or family members to have the experience of doing it with your support in that session. So that would probably be an important strategy. Maybe they could videotape how things go at home and bring it in, and you can talk about it and look at it together. They're just a few things I can scrape from my mind without having done PECS for a really long time.
Thank you. That's a great answer, Melissa. Felicity, I've got a really great question from Shamila, who's asked for Felicity. You mentioned the kind of the task of filling out many different forms in many different services. If you can, could you comment on what you might suggest to be improved within that within a sector? Do you think there could be one form that all providers can share together? Do you think that the system could consider a change within that?
Yeah, definitely. I just filled out a real estate form, and it's called One Form, and I just fill that out and I send that to every real estate. So something's very similar, you know, one type of application form that can just be sent to multiple different organisations would be my perfect life, and that can be saved as well, so you don't have to write that one thing out all the time. I guess too, one therapist sat with me and helped me fill out the form on the day. You know, I tried to fill out as much as I could, and then they sat with me for the rest of the time and filled it out. So I thought that was another great way. I guess also too, sometimes with the applications is making words a bit more simpler. I really love simple words. I can really understand that stuff, you know, so making words, yeah, a lot smaller, a lot simpler. Yeah, I guess that's just some of them.
Thank you so much, Felicity. And another question for you. Can you describe some ways that practitioners have included you in sessions with your child to ensure that you and your child can actually lead the important decisions about his and your life?
Yeah, unfortunately, I can only speak of one, and she was amazing, and it was our speech therapist. You know, she sat with me on the floor with my child, and we all sat there, and we'd done the whole session together. So if it was a board game we're playing, the three of us played that together. If it was my son playing on the iPad, which he plays every session right at the end, it was all of us doing that together. And as we were going along, I think she could see some of my facial expressions of not understanding, and she would sit there and explain that in quite detailed with me as well. We have tried using the pictures, and for my son, he just doesn't really like that stuff with me, but he really loves it with the therapist. So it's really interesting how in different places he'll do one thing and not the other, and maybe because I don't have it down packed as good or I don't make it as fun. But yeah, you know, sharing that stuff, watching how this woman does that stuff with my son in person is amazing compared to other places where I walk to the reception and that's it, and that's the end, and get a 2-line email saying your son was great. So yeah, really sitting down on the floor, same level, again, plain English, very simple words for me, and really watching my body language as much as she was interacting with my son.
Great. Thank you, Felicity. Mandy, a question for you. How do you work with parents who become stressed or frustrated by the challenges that they have in communicating with the child?
Well, I guess firstly, just to validate and understand their perspective. I think for a lot of them, they don't have a voice, or they haven't felt like they've had a voice in the system. So, you know, normalising their experience and validating and, you know, really listening is really important. And I guess asking what they need. The one that I'm working with at the moment is having a huge amount of frustration with the school, who's not picking up on the nuances that are going on for the child. So this child uses quite significant social masking at school, and they think she's quite fine at school, but she gets home and she has meltdowns because she holds it in all day. And so for me, it was about, you know, what do you need? So asking the parent what they need, and then going to the school and actually trying to support the school to understand what social masking is. You know, what are the needs of this child? How might they work with her and support her as much as possible, and doing that alongside the parent, you know, making sure that they are feeling like I'm doing what they're asking of me. So I think advocacy is a really important role there. And sometimes for schools, it's just, you know, that they don't have the time, or they're just picking up on what they see. And so for this particular child, she really struggles to trust people. So it's about, you know, how do we find that safe person at school? How do we make sure that whoever's engaging with her understands her needs and the way she expresses those needs?
Thank you, Mandy. Melissa, one final question for you, and then we'll ask each of our panellists just for a final observation or comment. So, Melissa, how do you help children with communication issues to feel a sense of connectedness to their peers, siblings, and families?
I'm not on mute. So, first of all, I think connectedness comes from a place of being heard and understood, and also the experience of mutually enjoyable activities or just mutual connection and enjoyment. I also think that when families are empowered with some knowledge and workable, functional ways to feel like they're supporting children's development, then it helps build positive experiences together. I wanted to talk about I have a sister who has significant disabilities, and on reflecting about some experiences from when I was really young, which really shaped me into being a speech pathologist. So as her sister, there's this time that was really pivotal for me when I felt really connected and empowered to help her. And I remember when I was about 6 years old, so I was pretty young, and my whole family was invited to this open day at a new early intervention day program that my sister would be going to. And I don't know if it was the OT, the speech or the physio, but it was a multi-D team, and I was on the floor with my sister playing, and they got down on the floor with me. They saw potential in me as a sibling to support her, and they helped me see things that she was doing and what it meant, and the things that I could do to extend on that. And that in itself enabled me to then build upon that. So, you know, from that point, I think it helped me see all these other ways to support her and connect with her, like whether she liked building blocks and I could build blocks with her, or I used to drag her. She used to have this little bike she'd sit on, and I'd put a rope to my bike and drag her down the driveway and stuff, but she'd love it. And so just finding those things that are mutually enjoyable, because I think connection is also, it's an emotional space. So that's from a sibling perspective, but as a therapist, I think that, I guess, finding those joint or common shared interests, what does the child enjoy that the family can do with them, and what they can expand on as well, and using those joint interests to build a communication upon. And also looking at joint attention and play opportunities, and connecting on an emotional level through play, and being more tuned in to the child's behaviours, so that when you respond, it's a responsive interaction, so that tuning in does something, there's just this magic that happens because you're doing that and giving that to them, and it just then can become more natural. So trying to increase those experiences, but also as a therapist, looking for times when you can notice there are missed opportunities, maybe not intentional, but it's our job to notice those times and help families in a non-judgmental and in a gentle way, helping families to see that too, and then make adjustments in their responsive interactions.
Thank you, Melissa. And thanks for those answering those questions to all our panelists. It's been so incredibly insightful. I'm just going to now invite each of our three panelists just really quickly just to summarise with any last comments. So I might start with you, Felicity, if that's okay.
Yeah, sure. I guess what I want people to take away, and I said it before, is just remembering the parents are human as well. A lot of the parents are going to be tired, worn down, frustrated that they've been on wait lists or try to get places for their child. So sometimes we might not come across the happiest people either, but give us some time, and we're really one of the best people to be able to let you know about our child, and keeping everybody connected, every service that can be connected about the child, making sure that trying to touch base is there so everyone's on the same page.
Thank you, Felicity. Go to you, Mandy, for final observation.
Thanks, Dan. Yes, look, I think for the most part, for me, it's about walking alongside. So doing with, not doing to or for. So quite often it is really just about engaging in relationship and building that sense of safety and trust. And a lot of the other work follows, once you've been able to do that, because remembering a lot of the families that we work with have had multiple interactions with services over a long period of time, or maybe they're new to the services, but it can be extremely daunting and frustrating and tiring and disempowering. And so wherever you can build that sense of safety and relationship and give them a chance to have a voice and play a role in their own care and the care of their children, I think is really important.
Great, thank you, Mandy. And finally to Melissa.
I'd start by echoing what Felicity and Mandy have said. I think it all starts from a place of relationship and respect, and specifically the speech pathology side of things, gathering good information, making informed decisions, and doing those in partnership with those key people in the child's life, and valuing not just what information you gather with your own eyes and your own tools, but the information that others have about that child. Like Felicity said, the parents would know the child the best out of anyone. And likewise, moving forward with intervention, that it's best done in partnership.
Great. Well, thank you once again to all our fantastic presenters. That has been a really wonderful webinar. Really enjoyed that. So thank you to Felicity, Mandy and Melissa once more. And thanks to the over 460 of you who've tuned into this. It's been really great night. So thank you for your great questions and for listening to our presenters. Don't forget though, other supporting resources which our presenters have committed to can be found using the blue arrow button. But for more information about Emerging Minds or any of these materials, please contact us on www.emergingminds.com.au. And don't forget, we've got a host of really exciting webinars coming up for you this year, so please join us for those. Really look forward to hearing your survey responses and feedback, which you can log into by using the yellow icon. Don't forget also you'll get a statement of attendance for this webinar within 4 to 6 weeks, and you'll be sent a link to the recording of the webinar and associated online resources within 4 to 6 weeks. So yeah, once again, this webinar was co-produced by MHPN and Emerging Minds for the Emerging Minds National Workforce Centre for Child Mental Health project. The project is funded by the Australian Government Department of Health under the National Support for Child and Youth Mental Health Program. Would you like to continue this discussion with local practitioners, or perhaps start discussing issues of local relevance? MHPN project officers are available to help you establish or join interdisciplinary mental health networks across metropolitan, regional, rural and remote Australia, either face-to-face or online. They have 373 networks around the country as well as online networks. So please visit an online map to map out which networks are close to you at mhpn.org.au, or contact Jackie O'Loughlin at networks@mhpn.org.au. So just a few words about acknowledging the customers and carers who have lived with mental health illness in the past and those who continue to live with mental illness in the present. At MHPN and Emerging Minds, we'd also acknowledge the amazing contribution that those consumers and carers make to our products and content. So I'd like to acknowledge all of those people who participate so fully in our program. So that's all we have time for tonight. Thank you so much, and look forward to chatting with you further throughout our MHPN and Emerging Minds webinar program throughout 2021. Thank you so much. Good night.